This is Southern California EMS Training Institute. Today we're going to teach you how to deal with a penetrating chest wound and how to actually treat this in the field. So when we're dealing with the penetrating chest wound, the problem is now we have an opening into our patient's chest cavity or potential pleural cavity, right, where it's that lining in between the lungs. Now what can happen is air starts seeping in through this hole and actually starts to collapse one of the lungs. So this needs to be dealt with. What we do is we actually apply an occlusive dressing. An occlusive dressing is something that doesn't let air through it. Now, we don't have something on the ambulance that's actually titled occlusive dressing, so we have to be creative. This is typically what we use in the field. It's petroleum gauze or petroleum dressing. We can actually use the packaging from this, or we can actually use the dressing itself inside, and we'll go over that. But we have all sorts of things that we can use. Sometimes it's just about being creative with what you have. A plastic bag, right? We have a lot of these on the ambulance. Sometimes even some of our equipment will come in plastic, right? And this could be placed over the wound, and this is going to keep air from getting inside. This would be a quick fix, something that would work to help keep air from going in and out of this wound. Typically, when we first walk up onto this patient, we should cover this with a gloved hand, right, to keep any air from going in there for the time being, and then we need to apply the dressing. I personally prefer the petroleum gauze on the inside. This is a gauze that's actually covered with Vaseline, right? So this can work in a couple different ways. We can take this and we can just put it directly over the wound, and it kind of self-seals really well. I would just kind of push it down all around the patient's chest like this. But what else you can do is really simple. I just rip this thing all the way off. Use that as an extra cover. And what we need to do is we actually need to dress this on 3 sides. So the idea here is that when we have, right, this patient is breathing on his own, as he inhales. Did anyone throw me some shears? When this patient inhales, what we're going to do is we're actually going to suck this wound into the patient's chest, and that's going to be good for not allowing any air to come in. But as he exhales, it's going to help kind of push that dressing out a little bit, and it's going to relieve any pressure that's already been built up inside of his chest cavity. So that's why we do a 3-sided occlusive dressing, not 4-sided occlusive dressing. So it's going to help self-release some of the pressure that's already been built up in his chest. That's how we're going to treat a open chest injury. What we would want to do is we'd also want to assess the back for maybe a potential exit wound or anywhere else around the chest. One way to know that this is working is to auscultate lung sounds bilaterally. If we hear diminished lung sounds, obviously on this side, it should be starting to improve after placing this 3-sided occlusive dressing. So that's how to deal with the penetrating chest wound. Thank you guys very much.